All right, good morning. Welcome to the Pulse of Healthcare. This is Dr. John McCormick. I'm here with Peter, and we're going to talk a little bit about regulations and innovation and how those things kind of compete and drive up healthcare cost or drive it down. So, like we always do, we're going to kind of jump in the Wayback Machine. And fortunately, I'm here with Peter, who's been there, back in the day. Not saying that he's older than me. Well, maybe a little bit.
But he is.
A little bit, not much. But, it's funny. I was looking on the internet yesterday and something came across my feed, as it always does. And they were talking about computers, right? And what a gig of information cost 45 years ago. So we're thinking, I'm thinking, okay, 45 years ago, wow, I remember that. And I remember how expensive my very first home computer was. And even some of the things that were going on, at the time where, our Apple and all that were saying, well, the most you ever might need is, 512K of data, and on a little floppy disk and all of that. And that was a lot. And I thought I had a pretty high-speed computer. I had dual floppy drives. I was kicking it, But reportedly, like if we were going back 45 years, 1 gig of data was worth $438,000. And I was like, holy mackerel. But we know from computer innovations that the turn time on that started at about 5 years. We were the acceleration curve on that. So let me put that in perspective. We've doubled our technology every 5 years, starting about 45 years ago, maybe 50 years ago. You can back up all the way to the beginning of the Industrial Revolution and see the curve sharply increase. But when we hit the technological revolution, the doubling has become faster and faster and faster.
Yeah, and I think in some parts of the medical care, innovation has worked very, very well to lower the cost, bringing computer space, data storage, even telehealth. But in other areas, it's really made it a lot more expensive.
Absolutely. And, so let me contextualize that for you for just a little bit. So remember I said how expensive it was, $438,000. So if you transferred through the years and it doubled and doubled and doubled, it went from 438 to 40 years ago about 238,000 to 35 years ago about 48,000 to 30 years about 5,000, 25 years ago about $455, 20 years ago $5, today less than a penny.
Yep.
So technologically in the computer age, as we've advanced, things have decreased. Now, is there an example of that? Well, there's examples of conveniences that have been sprung from that, like telemedicine that Peter just said. LASIK surgery is a good one. LASIK is not something that health plans pay for, right?
Right.
So what's removed? The burden of regulation, all of those crazy things that the government and insurance companies and all the CPT and billing codes that make things more expensive. So if you were to get LASIK surgery in the 1990s, it would run you about $3,000 to $4,000 per eye. And that was when it was considered experimental. All right? So there was a use for it. People did it. It seemed to work for about 10 years, and then they'd get a touch-up kind of scenario. But $3,000 or $4,000 an eye. And that was actually considered to be a pretty good cost if you bounce that against the, cost of glasses and all of those other things at the time.
Loss of sight was your alternative.
Loss of sight would bad, right? So 9 years later, just 9 years later, that cost dropped down to about $2,000. So it was about half.
Right.
That's the market. People started getting interested in it. They improved the technology that was performing the surgeries, and then they cut the price in half. Now, if we were using the same dollars, right, and the same type of technology today, that would be about $1,500, all right? What you see today is you're seeing an uptick in LASIK, but that's not because the procedure hasn't gotten cheaper. It has. What's happened is the lenses and things they use for your eyes have now gotten more expensive. So what you see now is a weird range of, you can still get it for about $1,500, but you can also spend up to $4,500. But now you have progressive lenses and all kinds of ocular things that they can put in your eye that are far more advanced than anything they had in the 1990s. So I think we're going to see that curve drop back down again, because once those new lenses stay on the market for a little while, then you'll see that curve drop back down.
And what expenses are we looking at? Particularly, what I look at is the drug market, all the innovations that they brought out in the drug market. But then, they charge for that research, they charge for that early development of innovation, and try and keep it for 10 years under their protected.
Yeah, there's a push-pull, right?
Yep.
I mean, obviously, you have to invest something in research and development, right? And the U.S. does more research and development in the drug and pharmaceutical than any other part of the country, any other country in the world.
Yep.
And we're a capitalist society, and the investors want to make money off of that. So I get all that, and
right.
At the same time, there's how much they're charged and how much it actually costs to produce, including research and development. So there's a fairness factor there.
Right.
And I think we're kind of out of control on that percent. If we're paying $500 or $600 or $700 for an injection or infusion or a new drug here in the U.S., and they're getting the same drug in Canada or Europe or Australia, and it's a third the price, how is that fair to the American population?
Correct.
So, we ought to be able to, we ought to be able to pay the fair market rate, which is the rate that's being charged. We're in a global economy. The rate that's being charged globally for that drug, all right? Not, oh, you're in America, so you have to pay the significant markup. And I just think so in the healthcare world, I think that's an unfair comparison for what we're trying to do, right?
Yep.
So that's definitely an innovation versus regulation versus market scenario. That's a little off course, but it's a valid point. But let's bring it back to regulation. So remember, we've talked a lot about the interaction between the provider, generally the primary care provider, and the patient is really what's been impacted pretty significantly since the 1960s. If you go back historically before that, most of the interaction between a primary care provider and a patient were direct. There was no insurance product between us, right?
They still made house calls.
It was a house calls, it was a cash deal, And so what we've done is through this insurance quote unquote need and regulation, we have to have all these different things. We've required doctors to have fully electronic medical records. Well, now I've got to buy an expensive computer program, and it has to integrate with all the other programs for billing and collecting, and I've got to be able to submit all this data to, Center for Medical, the CMS, and all the, and I don't have one insurance carrier. I have 50 or 100 that I'm working with in my small practice. So my practice administrative burden has gone through the roof. So this is where we talk about innovation-wise, the technology, the computer, way cheaper, right?
Right.
And then we took something that was cheap and convenient, which would have been great for capturing medical information, and then we started layering on all these regulations. And so what happened is my doctor visit, it used to be $5 or $10, now is $50 in my copay and another $100 to $150 to my insurance company.
Right.
And most of that is administrative burden. It's the burden it takes to bill and collect and in many cases rebill because the codes that I have to use are complicated.
Yep.
And if I don't bill it the right way, the insurance carrier kicks it back. And if I don't capture the right information, my reimbursement rate for Medicare and Medicaid goes down. So I have all of these things that are competing for my attention, when my attention should really be solely based on delivering high quality health care to you, the patient.
Well, I think it's as simple as 20 years ago, it was the doctor you saw, and today you see the doctor's businesses with armed patient advocates and assistant physicians and different layers even to see the doctor. Now, all that information and technology works very well on keeping a track for it, but it's changed the doctor's business from being a doctor to being a business.
Right. And you know, if you're getting into the medical world because your passion is about healing and serving people, much like a teacher or a fireman, I mean, those are service calls. That's something that calls from your heart. I need to serve,
Yep.
and do that. That does not necessarily mean that your brain and your desire is tuned to business. And so when I layer on all these burdens of business and I'm not tuned to business, I'm tuned to delivering high quality health care, then I'm forced to bring on additional administration and things like that. So what we're seeing out in the market right now, and it's driven by Wall Street and it's driven by big insurance and it's driven by big hospital systems, is this consolidation and basically this acquisition of the small business private practice doctor. And I think at the end of the day, that's going to end up hurting the delivery of healthcare. And people think, well, it'll make the costs go down. Well, every place it's happened, the cost has gone up. Every single place it's happened, the cost has gone up because you've eliminated competition, right?
Right.
Competition's what keeps the price down.
Well, and you've added another layer, which I'll call the corporate layer,
Right.
that has to earn their 15% or whatever the acceptable rate of return is, on top of what it used to be. So now it's gotten more expensive. Yes, the technology is there and the administrative support is there, but the person who loses is the patient.
Right. So I think kind of to summarize what I wanted to say when we talk about innovation and regulation, innovation's great, all right? And I think we've gone a long way for all of us using innovation to make our life easier.
Oh, absolutely.
Right? But when we combine that with over-regulation and overburdensome things, and it's, people imagine in their brain, right? Now that you can do this through technology, I'm going to give you more to do. But that more to do is not necessarily beneficial, and it's not helpful, and it doesn't improve my product, which is the delivery of healthcare.
Well, and regulations cannot protect the patient or the doctor, for that matter, from everything. You cannot write an all-encompassing regulation. You have to have people to make judgments, common sense judgments, for the benefit of moving medicine forward.
Absolutely. And I think that's why what we're seeing today is this resurgence of the private practice under the direct primary care model, that are, these doctors that are entrepreneurs and medical professionals that are taking a step back and saying, I'm going to unplug from the medical insurance regulation system and I'm going to get back to delivering that direct primary care. Unfortunately, that hasn't spanned over to specialists yet, and we're not seeing that with hospitals yet, but there's a movement in that direction, and it's actually happened here locally in the Houston area that there's a few new hospitals coming on board that are going to be able to plug into this model, using transparent pricing, using, subscription-based models. So I'm excited to see where that goes over the next 12 to 24 months. And I think what we might see, hopefully, if this really gains some traction, we might see a great combination between that innovation of, remote patient monitoring and telemedicine and all those cool things that we should use technology for, and that divorce from some of the burdensome regulation that are driving up cost. And ultimately, we should be able to deliver health care to the individual and small and medium employers at a reasonable rate.
Well, I think that's absolutely the case. I mean, innovation leads to improvements and also leads to a new standardization. So it's an evolution that takes place within an innovation, and we're in that process.
Yeah, absolutely. All right, everybody. Thanks for joining us for the Pulse of Healthcare. We'll see you again in a couple of weeks. This is Dr. John McCormick and Peter, and we're out.